right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer and we're doing more facial sculpting today. Now we have a younger male, super fit and athletic, who we've been building up a little bit with natural collagen producing Sculptra. And we did a little bit of filler, nothing crazy. But this time we're going to be using some Juvederm products today. And I just want to do balancing. Is it not going to look overdone or anything because he already has a very structured face, but our goal with him, because he's super athletic, is to maintain his volume and give him that chiseled contour so that when he goes and works out and he does lose some weight and stays lean, he doesn't lose anything in his face. And if you take a look at him, let's show him from the front. You know, most guys have a lot of loss in the temple area, so we're going to work to give volume here. His chin is a little bit recessed or in compared to his jawline, so we're going to bring that forward. And just subtle softening, just enhancement of the cheek, a little jawline, softening of folds, and just a little plump on the lip. That's it. So we're going to start in the temple, and for him, we actually need to do both the deep and superficial temple. So we're going to go all the way down initially, and we're using Juvederm Ultra Plus. This is going to allow us to do a lot of lifting. And I like Ultra Plus in the temple for men as an alternative to Radiesse or other collagen-producing fillers because it gives a lot of lift. Going all the way down, now moving up on the temple with another half a syringe to give him volume. You're going to see this basically immediately, which is going to be really awesome. We're in a really safe plane here. Great, so we can, DJ or you guys, here, hold here, hold on, right that. Let me switch, then you pause. Okay. We're gonna go to just one at a time. All right, let's move this back. All right, so now on that second side, we're gonna do that same thing. Remember, you're gonna watch the blood vessels. He's got very tortuous blood vessels there. We're going all the way down and doing a nice lifting. Now you guys know I always tell people when you do temple injections, plan that you may have a little pain tomorrow when you chew because we're going through that muscle there. And don't be shocked if you kind of hear the filler being injected because you're all the way deep on the bone.
How does that sound like?
What does it sound like? Some people say crunching or a little bit of pressure. I think he's doing great. Okay.
Do men need more amounts than women?
Say that one more time.
Do men need more than women
Typically,
sometimes?
yes. Typically, yes, they do. If they're more hollow. Now, like him, I'm gonna move up even a little higher to the superficial temple and do another half a syringe. I just want him to be really balanced. And this prevents drooping of the lids. And then I'm going to use this other half syringe, that's great, to kind of lift up here, to just contour a little bit of his lateral. Now turn here on his jaw. His jaw is awesome, but I want to give it a little more structure to the back. So I'm just going to kind of do this, come to the back at the 90-degree angle, very small amount. He's doing awesome. And just define that 90-degree. I just want to make it plump up. Take a look at that already. You can see, look, that nice 90-degree angle. Okay. Go that way. Like this. And you guys make sure to wipe over there. And now we're going to do that same thing. I'm going to go a little bit higher up on the temple. Go a little bit higher here. Great. And that's going to start pulling some water in as well. And then again, I'm going to turn this way and lift up. I'm going to show everybody here. Now some people would blend this area here. I think for him that's the natural look of his face, and you don't want to start trying to change it. We just want to enhance what he has. So creating a little bit more of that 90-degree. Very defined over here.
Hello from Kuwait.
Hey guys, we may be coming there really soon. I want you guys to know, a little secret coming. Can't wait. Can't wait, Kuwait.
That's not really a secret.
I know. It looks great, doesn't it?
Yeah.
Now, to balance that out, oh, that's really, really good. To balance that out, we're going to do a little bit of the chin. And my goal here is to bring it forward just a little bit. It already looks really good. Perfect. I always tell people I have a little patience with the chin. It always wants to swell up a little bit when you do treatment. And for him, we do need a little bit of that filler in that lower cutaneous lip region, or marionette, people call it, right here. Okay, yeah. That's what you do, Courtney.
What did you use to numb?
Topical numbing, topical lidocaine. Really good. And we're using Juvederm Ultra Plus or Ultra? I forgot what we have. Juvederm Ultra to get a nice softening look. I like for him this would be great because it'll pull a lot of water in and be able to soften everything. And then the last part is to just do a little bit to mid-face, but nothing that's going to overly enlarge him. You don't want him to look overdone. So we just want him to look like sculpted. So we're doing like very small aliquots. It's okay, get another one. Really small aliquots, he's super lean. We don't want to make him look too overdone or anything.
How long have you been injecting?
13 years. Great. And see, now we just enhance this area there. We're going to do that same thing over here. What's great is we're going to build upon now the Sculptra.
Do you guys have any questions for Dr. Emer?
Take a look. Smell. Okay,
Somebody saying hi from Colombia.
hey guys, love Colombia. I learned lipo there, and we come there usually every year or two. I'm going to do a subtle bit to the folds, just to be preventative, to balance everything, because now his cheekbones have a little definition more than it did before, to balance out his jawline. Beautiful. And then lastly, I'm going to use my favorite product for kind of around the mouth and balancing everything. We're going to do a little bit on the edge here. Velour, Juvederm Velour. This lasts a little longer. It's going to soften the edge of his chin.
This is not painful. The patient has been numbed.
Minimal pain. It's not 100% painless. That's minimal. And
How do
we
you-
don't need much in his lips. Look how beautiful these are, you guys. These are like perfect lips. Everyone wants to kiss them. Kiss them is what I say. So what we're going to do is just do very subtle. 0.1 in area, almost nothing, right at the edge to kind of just plump them out. You can see that, that's perfect. We're going to grab the Cupid's bow and give him a little definition. Some men actually look very good with this. He happens to be one. And we build that out. And we're going to do just a teeny bit in this medial component.
How do you get masculine cheeks without looking feminine?
Take a look, right there guys. Elevated high and sculpted right in the medial portion. Now that side's done, you could see, look at the difference. I'll do one more injection, a little poke in this medial portion. You can see now one side's done versus the other. Okay, nothing crazy.
What product are we using?
This is Juvederm Velour. And again, I'm going to grab that Cupid's bow on him and do just a small aliquot there, because he can pull that off. And then we're going to come from top, do a couple little blebs. One more. Beautiful. He doesn't want anything overdone, just subtle. And I want to balance out now a little more in the chin. And the key also is softening on the lower part of the face right here. And then I want to give him just a little more enhancement in the cheek because I like it so much actually.
If you guys want to know how much it costs, or if you guys want to book an appointment, just send us a DM with your name, your phone number, and your email, and we will get back to you soon. How come you're using the same filler for lips and chin?
Why not? It look really nice, guys. It softens everything. All right, so we're basically complete. I'm just doing fine tuning every area.
You can email appointments@jasonemermd.com.
Okay, so now let me clean him. I'm super happy right now. I'm stoked. Super stoked at this result. I can't wait. He's tearing a little bit of joy because lips hurt, I know, but he's happy to be happy. All right, so let's just check everything looks nice and even. Gotta hold here. This is an impending little bruise, right? See, just hold right there firm. Good. I want to just clean him while you're holding there. So we're gonna clean for a sec, and then I'll show you guys the result. We'll have him show the result. Everything will settle within 2 weeks. He doesn't even look like he's gonna be bruised. He can work out tomorrow if he wants. I want him just to rest tonight and enjoy his new face. And this is the sculpted look, okay? I'm gonna point out what we did while we let that hold for a second, and I'll show you. We filled out the temple a little bit. We gave him lifting in the cheek, but again, keeping it more medial and superior. Defined the angle of his jaw. Beautiful. Bite down so everyone can see. Perfect. I brought the chin out a little bit and strengthened it, making it a little more bold. Softened his lips. He already had nice lips to begin with. Just to make it look good. And then we gave a little bit into the sort of under eye area and around the folds. So let's show him, guys. Let's
This
do an
is
Emer
filler.
reveal. Okay, let go. Yeah, that'd be great. All right, so take a look even with the
Okay.
swelling.
Here you go.
Show
Oh
him.
wait, give me 1 second. There you go.
Hold that there, take a look, and then we'll go to the mirror. I want you to look middle, yeah, perfect. So a little bit more lip, nothing crazy. This I think you're gonna like the most. A little lifting here and on this side, a little sculpting through there. Look at the jawline, bite down, turn this way. Super sculpted, like this is what everybody wants. Everyone's looking for this nowadays. And then chin-wise, if you look straight, it's a little more bold and straighter. And if you turn all the way this way, more projected towards your lip. Take a look. Don't turn your head. Look this way, but look to the left now with your eyes.
Just look with your
at the
eyes.
camera.
There you go.
See how it's more projected now, aligned with your lip? So now, let's give you the mirror.
I'll take this back.
Hold on. Take a look. What do you think? It looks good. Looks great. What were you looking? What did you want? What were you looking for?
Just what you gave me now.
Okay, well, so sculpted. So he's happy.
Sculpted.
The key is we'll see how everything settles in the next 2 weeks. And once we do that, it should be really soft, no lines, super chiseled. That's what we want. He's athletic. We need that cut, chiseled look. So that's facial sculpting.